The month of May is celebrated as Mental Health Awareness Month, a time to open up dialogue about a topic that affects many of us. This week specifically is celebrated as Children's Mental Health Awareness Week. Here to tell us more about it is Katie Emer with AltaPointe Health. If you're unaware, yes, we have the same last name because Katie is my wife. Hi, Katie.
Hello. Good morning again.
Good to see you again. So I know, you and all the folks at AltaPointe are so passionate about what you do for all ages. Tell our audience why it's important to specifically have a Children's Mental Health Awareness Week.
Well, I think it's just a great opportunity to shed a national spotlight on the importance of taking care of every child's mental health care and really kind of encouraging parents to recognize mental health as an important part of a child's healthy development. Research shows that 1 in 6 youth will experience a mental health condition every single year, but only about half of them actually receive treatment. So I think the more we can have these conversations around mental health, the more we can open up about our feelings and emotions and make that a more comfortable conversation, then the more comfortable families will feel with seeking treatment from a professional when the time is right.
Yeah, especially with social media and all the things that the kids have to deal with nowadays. There is so much pressure on them, so much societal pressure. So absolutely have these conversations and get the help you can if you need it. So if a parent is concerned about their children's mental health, what does AltaPointe have to offer?
Well, one of the beautiful things about AltaPointe is that we have a full continuum of care. And what that means is we have a wide variety of programs and services to meet many different levels of need, because we realize that children are all very unique and there's no one-size-fits-all mental health treatment plan for our kids. So we have our typical clinic-based therapy and psychiatric services where you can go in and meet with a therapist once a week, once a month, whatever's needed to address those issues. And then if medication is needed, you can add in a child psychiatrist on top of that to help with medications. We also have school-based therapy, which is an amazing option for many families, where a licensed therapist is on many campuses throughout our local area. AltaPointe has therapists in 58 of Mobile County Public Schools, as well as all Baldwin County Public Schools and some of the local city school systems as well. And so that kind of makes more of a relaxed and comfortable environment for children, whereas they're going down the hallway to see Miss Amy from AltaPointe instead of going into a clinic, or they're just going down to see another teacher the same way a kid would go to a speech therapist or a reading coach. So it just makes it a more relaxed and comfortable environment. It also takes down some of the barriers of transportation for parents who can't necessarily take off work to get their kids to a clinic for an appointment. So we have school-based therapy, we have in-home teams who go into homes and work with an entire family unit. We also have day treatment programs, which is a little more of an intensive level where they get daily interventions. And so we have 2 different day treatment programs that are both housed at Bay Point Hospital. We have our West Mobile Academy, which is like a school and treatment program under one roof. So it's a therapeutic classroom environment where kids can get their academics, but also their therapists, their doctors, they're all on site to help encourage them to be successful as well. And then of course we have our Bay Point Hospital unit for those kids who are in crisis, and that provides that level of stabilization to get them back home and into the community. And then we can't mention Bay Point without mentioning our 2 furry friends. Zeke and Ollie have been here. We have our pet therapy dogs who come and visit with all of the kids at Bay Point in all of the different programs. So there's just lots of different services and levels of care to meet all of the needs for kids in our community.
So many different service options for so many different stages. Get the help and support that you need. And on that note, how can a family access these services we're talking about today? What steps do they need to take?
Right. Well, at AltaPointe, we've tried to streamline that process for families. There's one phone number that reaches all of our programs. It's our Access to Care line. It is 251-450-2211. A family can call that number, talk to a mental health specialist, and kind of guide them towards what program is going to be the best fit for them. There's also our website, altapointe.org, for more information, and our social media outlets as well. We have Facebook, Twitter, Instagram, and a YouTube channel as well. So lots of options to reach us.
Lots of ways to reach out, get the help and care that you need. And Katie, I know we're going to be seeing more of you and AltaPointe here on Studio 10 in the future, so we're excited about that, to share everything y'all have to offer.
Thank you so much for having us.
Happy early Mother's Day.
Why, thank you. I was wondering if I was going to get a little shout out today or not.
There you go. Yay. All right, great stuff. We'll have all their contact information online. Y'all go check it out.